There is concern this evening about enough men not being screened for prostate cancer, which often leads to serious consequences. Medical officials say that men are still coming in later in their life when they already have the disease. But there's another problem which is complicating their recovery. Some are using natural remedies with their medications prescribed by their doctor, and this is not a good idea. TVJ's Shamela Pullen explains.
Health report. According to the Jamaica Cancer Registry, 1 in every 6 Jamaican men has prostate cancer. Over the past 5 years, the number of men diagnosed has remained the same. Annual screening and testing are key tools to ensure early detection and treatment. Consultant urologist Dr. Belinda Morrison-Bligent says the ideal age that men should begin screening for this condition is 40. But men are coming in to get tested as late as age 69 when they already have prostate cancer, sometimes even at an advanced stage.
Based on our data here that we have from the university, we found that 44% of our men who presented with an advanced grade and 24% presented with an advanced stage. Ideally, we would want at least 90% of our men coming in with low grade, low stage disease. That's ideal aim. And we use a model from North America where once in the United States they introduced screening, 90% or more of their men were presenting with early localized disease.
Prostate cancer is a disease in which cancer cells grow in the prostate gland. The prostate is the size of a lime. It surrounds the urethra. That's the tube that carries urine out of the body. There are no early symptoms and the cause is still not known. Although there have been many public education campaigns on this disease, many men are still apprehensive about the DRE. That's the digital rectal exam, which is used to detect prostate cancer. Dr. Morrison-Bligent says most times surgery is an option when the cancer is advanced. But what doctors at the University Hospital of the West Indies are finding out is that men are using natural remedies to treat the disease. She says there is no evidence that this will work.
There is a lack of evidence for a lot of them, and there's a concern about safety. And sometimes patients will ask if they can take it with the medication that we're giving them. And the truth is we do not know, because without a study being done, we really would not be able to comment on that. But a lot of our patients do. There was a study done in our urology clinic at the university where it was found that a significant number of men took alternative or medication while taking conventional drugs.
With your health report, I'm Shamela Pullen wishing you good health.